Yes, this case a female patient post-surgical of pelvic cavity presented with nausea and vomiting. The ECG was recorded that revealed peak T wave, look here at the tip, tinting T wave, and narrow base. The base is narrow. This is characteristic of hyperkalemia. The hyperkalemia is manifested with a distinctive sequence of electrocardiographic abnormalities beginning with narrowing and peaking tinting of T wave. This, it's similar like this. Yes. Narrow base and narrow beak tinting. It is bacular. Look here how this line and then up, opposite of that of ischemia, in which the base is wide and the apex is not narrow. This is the ischemic T wave in patient with inferior wall myocardial infarction. This lead 2 and this lead 3 and this AVF. The age of this infarction is old or age indeterminate because the ST segment is returned to normal and T wave inverted with fractionated R wave. Maybe aneurysmal change, but the interior, this is V1, V2, V3, V4, V5, V6. The interior T wave, it's like this. Wide base and apex. This, and by shouldering, this is the shouldering, like this. This and this is the R wave. This is the T wave. This is the ischemic T wave. Shouldering, similar to elevation of shoulder above the head, like this. This is the head and this is the shoulder. The T wave becoming more than R wave, and it is wide base and wide apex. Characteristic of ischemic T wave with low R wave. Please see the base of the ischemic T wave. It is wide and even the apex is not narrow to the extent of that represented by hyperkalemia. Look here. Yes, this is the hyperkalemic. It is very narrow tinting and narrow base also due to accumulation, due to union of both T and U wave. Also some case of hyperkalemia. This is also hyperkalemia. Look here, the narrow base and narrow apex tinting here, small. Some patients with hyperkalemia also have ST segment curved and T wave inversion in V1 and V2. ST segment elevation, but it is atypical, similar to that of Brugada syndrome. Curved shape and T wave inversion, and then the T wave, it is peaked and narrow base and narrow apex. Yes, it is a good case. Remember this always. Put this picture in your mind, please. Imagine the peak of T wave, characteristic of hyperkalemia, and differentiated it from that T wave, hyperacute T wave in case of ischemia. Thank you for your kind listening and watching.